Hello everyone, this is Dr. Lakshmi Kalbande. I am practicing as a consultant obstetrician and gynecologist in Cloud9 Hospitals, Pimple Saudagar, Pune. Bartholin cyst is usually a pus-filled cyst. It occurs usually in the labia majora or labia minora. So when we say that it is a painful cyst, most probably the patient had some vaginal or pelvic infection and due to which the cyst has formed and there is now a pus-filled cavity which is there in the perineal region, due to which the patient will be extremely uncomfortable. Most common symptom is not being able to sit properly because the perineal region is extremely inflamed and tender. So the causes most probably are pelvic infection, vaginal infection. They may be sexually transmitted infections which may cause Bartholin cyst. Bartholin glands actually are some mucus secreting glands which are present in the labia majora near the vagina. So when the ducts of these glands get blocked with infection or with debris or with any other particles, the ducts get blocked and the secretions are there in the gland itself, and then the gland goes on enlarging and then there is pus formation inside the gland itself. So the symptoms are usually pain. It starts with pain, difficulty in urinating or painful urination or painful defecation is also a common symptom. The decision to operate or to have a medical treatment is always done by the diagnosis of a gynecologist. When you go to a gynecologist after the examination, usually we come to know that it is a Bartholin cyst. No other specific investigation is really required, or an ultrasound is also not required for the diagnosis. It's just a spot diagnosis wherein we see and examine the patient and directly we come to know that it is a Bartholin cyst indeed. And the decision for either a medical treatment or the surgical treatment is always dependent on the treating gynecologist, depending also on the size of the cyst and also the symptom of the patients. If the symptom are very severe and the size of the cyst is very huge, usually what we call as an IND, incision and drainage, is done. It's a minor procedure which is done under local anesthesia. So we drain the pus out and we remove the cavity of the Bartholin cyst along with the capsule so that the recurrence doesn't happen. If the size of the cyst is extremely small and the symptoms are not that major, then we do opt for medical treatment in some of the cases.